Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our interview with Dr. Neena Champaigne, who is with Medical University of South Carolina, where she is a clinical associate professor and the division chief of pediatric genetics. It was a fascinating conversation. There were so many different aspects to genetics. The one that I really love is just the fact that because you can do something doesn't necessarily mean that that person always wants to. And I thought that Dr. Champaigne really walked that line really well with her patients. She said, she helps them on their odyssey. I think she called it a genetic odyssey, and really just walks alongside them. And if they want to know certain things, she's happy to delve into that. But if it's something that they pull back a little bit, she's okay with that too. And then they're also there because they can't always, it's not wizardry, they can't always treat these things. So sometimes you're diagnosing that there's a condition and then you can help with the treatments, but you can't necessarily reverse it. So I said that incorrectly. You can treat them. You can't necessarily always cure them. And so a lot of it is about healthcare management, and then even helping people and other doctors who aren't geneticists go through the barriers that they may have with insurance, trying to make sure that these people can get insurance to cover the cost of some of these tests that are so necessary. And then she heavily focused on newborn screening, which she told some really great stories about how that can make a difference in children's lives, catching conditions before they even might present symptoms. And in some cases, one story she shared, they saved a life. A child who probably wouldn't have made it past 1 year old now can potentially live a normal life. So it was a fascinating interview that once again ran the gamut from A to Z of genetics, and it was fascinating. Apoorv, what was your takeaway?
No doubt, Stephanie. This is just unbelievable how much we can learn. I think she had me from the beginning, which was her story, and how as a ninth grader, which I really related to because my daughter is a ninth grader and she's kind of going through the biology phase, and that's how she got hooked on genetics with Punnett Square. So I just love that she just kept following her interest and kept doing what she wanted to do, and as a result, she's wound up going through many extensive years of training, multiple residencies. Now she has multiple board certifications, but she's also already been out there for a long time practicing. So she makes it seem very real. She makes it seem very, very doable, and at the same time, very enjoyable. I think she's a breath of fresh air, pursuing something in the field just because that's what she enjoys doing. And as a result, we can look at the kind of impact that this field has made in a very short amount of time. I think she was saying that it's somewhere around 40 or so years that it's actually been recognized as a specialty. But within that short amount of time, they already have great assessment tools that they're expanding. They have great interventions now that they're also finding things that they can do something about if they find an illness. And they're starting to create more policy and awareness and education. So I really love that aspect of the story. And I think our audience is going to find this very enlightening and fascinating as well.
Absolutely. So thank you all for joining us today, and be sure to stay tuned for the full interview on Thursday. We'll talk to you soon. Bye-bye.
Bye-bye.